Doctors, what was the most shocking case of, oh, I thought that was normal, you've seen in a patient? ERMD here had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast, then down it. Once we finally cut the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 bugs. I knew by the smell that something under there wasn't right, but wasn't expecting that. The patient seemed completely fine with it. Whatever. Next story. MD here, a couple years back, had a walk-in complaining of a few months of abdo pain and swelling. I crap you not, the man was Simpson's character Yellow with jaundice and ascites, fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. Next story. When I was a med student, we visited a clinic in the country where I studied. Lots of people with horrible injuries and used the local elixir of dirt/motor oil/spit from the local old lady to patch up an exposed arm bone or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom or mold, growing through the skin into the outside world. Constantly bled anytime you touched it. Her family shamed any injuries or impurities, and she thought she just needed to keep it covered until she got better. Next story. Not a doctor, but a patient. Went in for thigh and hip pain. Couldn't lie on that leg for more than 30 seconds without pain. I thought it was muscular, and my doctor thought it might be radiating back pain. I had several x-rays and learned I had broken my hip sometime in the past, had a floating bone chip in my hip, degenerative disc disease, a birth defect in my spine, and mild scoliosis. Next story. I don't know if this fits, but here's a story about my husband. We were messing around, and he chased me through the kitchen, took a hard left turn and lost his footing, fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg and knew immediately he was hurt pretty bad. He was able to crawl to the couch and, once settled, said he wasn't in too much pain. He decided to sleep on the couch that night so he wouldn't have to go upstairs. We made an appointment in the morning for the ER so he wouldn't have to sit there all day, but they didn't have an opening until 2, so we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we found out that he had broken his hip. In this case, breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe he was able to sit up and had slept on it, implying that we should have come the night before, and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out that he was in the early stages of osteoporosis due to a pituitary tumor in his brain. So we discovered a benign tumor, all because dude was wearing slippery socks. Next story. Patient here. Went to the doctor for a note to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach and said, "That's not normal," and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later, I get a letter from the doctors asking me to come in. Changed my shift, so I go, and the doctor went off at me for not coming in sooner and told me to go home and pack a bag. I'm off to Royal Brisbane. It might be cancer. More scans later, and it's decided that it's not cancer. It was a 4 kg cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Yeah, that's all well and good, but if the doctor orders a scan for you, you can't afford to wait 2 months to go in. I mean, you're putting your own life in your hands at that point, and it's not worth it. Just go to the doctor. Next story. Not a doctor, but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor, so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season, so we asked if he could take off his shoe. When he did, she immediately points to the side of his foot where there is a large, strange bump and informed us he had a broken foot. I didn't believe her as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has two broken feet," and sent us over to get x-rays from the hospital. I was laughing, thinking this was so crazy, believing there was no way my son, who was not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had two broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insoles for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. Next story. I was the patient. I got a new OBGYN, my fourth due to moving several times, and went for a checkup. Braced myself for the horrible pain and winced as soon as the speculum touched me. She immediately stopped, and as it turns out, extreme vaginal/vulvar pain isn't normal. But I just had 3 OBGYNs who apparently didn't care that I nearly cried in pain every time I was checked. Edit. Because several people in comments have asked. My doctor called it vulvar vestibulitis and said it's called a bunch of different things. That the name gets changed every few years. I think the term most used now is vulvodynia. No known cause. Maybe too many nerve endings in the area? Definitely bring it up to your doctor if you're experiencing this. From what I know now, some discomfort is normal, but the knife-like pain is not. I'm doing somewhat better now thanks to some physical therapies and some lidocaine ointment I can apply beforehand. Also, if you think you may have this and need to find a new doctor, I recommend finding a woman, and the younger the better as education seems to be improving. And talk to them before they touch you, and if they dismiss your concerns, find someone else. You don't need to worry about offending them. This is your body. Your health is more important than a doctor's feelings. If you have trouble speaking up for yourself, like I do, take a trusted person with you to help advocate for you. Next story. When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said, quote, "My brother's hernias were painful, but this isn't, so I thought it was just a quirky defect." I hope he was lying to save face, but we recommended he get it taken care of. Next story. Resident doctor here, although not an OBGYN. In my OBGYN rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I'd ever seen. It looked totally raw and macerated to the point that they looked like 2 large pepperoni slices. One of her breasts also looked like the wound led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. Next story. Worked at a dentist office. Patient presents for an exam. Concerned part of her tooth is chipped off. On examination, it's not in fact a tooth that chipped off, but rather a piece of calculus, which is built up of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material and was quite shocked to learn we were actually unable to see her real teeth, and she'd need an extensive cleaning to remove it all. Next story. This one is actually from back when I was a medical student, but it's still the weirdest thing I've seen. Sorry, this is long, but I promise it's worth it. This was my last rotation of medical school before graduating and starting residency. I had completed all my requirements and just wanted to take a few interesting electives of things I hadn't seen yet. This was a dermatology rotation at the VA. The rotation had been interesting and chill, and it was my last day, and my third to last patient as a medical student. The guy came in, and the resident asked him why he was there, and he said, quote, "I have hair coming out of my hand." I figured he meant a weird mole with some hair coming out, but this guy, probably late 30s or early 40s, says, "No, the hair is coming out from under the skin." The resident asked what he does for a living, and he says he's a barber. The resident tells me it's not too uncommon for hair to poke through the skin, especially for barbers who cut men's hair. It's short, thinned, and can be kind of pokey after all. And it was sort of like getting a sliver, but with hair. But the guy says, "No, it's a lot of hair. Look." And he holds up his hand, making a fist, and there's several hairs poking out from between the knuckles of his pointer and middle finger. I stare in confusion, and the derm resident grabs some tweezers and pulls out a tweezer full, maybe half a dozen, of short black hairs. The guy says, "Yeah, I already pulled out like 50. The derm resident was like, 50? So the derm resident numbs up the backside of his hand between the first and second knuckle and makes a little incision and starts pulling out gobs of short black hair. Chunk of 20, chunk of 30, etc. And now she's got the magnifying glasses on and the attached light, and she's like, "Oh my gosh, there's even more in there. Sir, do you know how all this hair got into your hand?" And the guy goes, "Oh, it probably came in through there." And he flips his hand over to reveal a hole in the palmar aspect of his hand's skin. Turns out the dude got a cut like 2 years before this, and it had never healed properly. He was diabetic, and he just kept cutting hair with this open wound on his hand. And probably every day a few hairs got stuck in his hand for 2 years. And now those hairs had tunneled through the webbing between his first and second fingers from the front of his hand and out the backside. Long story already. Sorry. The poor resident spent like 30 minutes milking his hand and fingers while more and more hair came out. She said, "There's no way I got it all out. You'll have to come back every 2 weeks for a few months to keep us removing more hair from your hand." Which is a weird sentence. In the meantime, wear gloves while you cut hair. We gave the dude a whole box of latex gloves. I don't remember anything about my last 2 patients that day. It was literally my last day as a med student, and boy, what a way to go out. Still probably the weirdest thing I've ever seen. Not to mention how, there's some hair in my hand. Happens, I guess. The guy was about it. Edit. Yes, this is 100% real. I would be proud if I could make something this weird up. The other question was if the resident did anything to address the poorly healed wound around the guy's palm. Unfortunately, I don't remember the resident addressing this, but it was several years ago, so maybe she did? I was pretty shocked by the whole thing, so my memory may not be 100% reliable. I suspect a few stitches and some dermabond could have at least closed it temporarily, as it wasn't that big, a couple centimeters. But I don't remember her doing that on this visit, and I graduated, so I never saw this patient again. I imagine it was addressed in subsequent visits. Edit 2. Clarification on the palmar hand wound. I described it poorly above, so hopefully this will clarify. He appeared to have a deep cut a few years ago, perhaps 3 to 5 centimeters, but through the entire skin. In the process of healing, remember, diabetics heal more slowly, especially in distal portions like hands and feet. The wound had healed such that the edges never came back together, effectively leaving a small, few centimeters, slit in his hand. So maybe saying open wound was incorrect on my part. More like an acquired dermal defect, a slit through all skin layers, small enough that anything of substantial size would never get through, but large enough for hair to easily slip through. It was not draining or bleeding, red or swollen, but clearly open, meaning allowing free access to the internal environment. It was probably 3 to 4 centimeters and 0.25 to 0.5 centimeters. Narrower at the edges, wider in the middle, so a wide slit. This is disgusting. It just shows you how wild the human body and anatomy is. When there are these kinds of defects and the body doesn't know how to heal itself. You could write a movie about something like this. Disgusting. I don't know if I want to see the visuals, but this is the kind of thing Barbershop 3, Barbershop 4. Which barbershop are they on right now? Yeah, I think you've got a nice plot point here. Next story. Not a doctor, but I was rushed to the ER when I was 23. When I got there, I was admitted as an undiagnosed type 1 diabetic. The, "oh, I thought this was normal" bit is that while living undiagnosed for about a year, I dropped 80 to 100 pounds. I weighed 120 pounds and was as weak as I was frail. I had stopped going to the gym months beforehand, so I just thought, well, I was skinny as a kid. Makes sense I would get this small if I stopped eating and working out. Next story. Not a doctor, but I did used to work in the emergency department of a pretty big hospital. This one lady came in with complications with her pregnancy. Apparently, a lot of things were going wrong, but she just thought that was part of the pregnancy until someone pointed out to her that it was not. Turns out she had a miscarriage. That was not a fun day. You never forget the cry of a mother who's just lost a child. Next story. Not a doctor, but related story of major illness undetected. My son, 13 years old, complained to me that his scrotum was unbearably itchy. I figured probably sweat, told him to wash the area thoroughly and make sure to dry well. Maybe dust some baby powder on there too. A couple days later, he said it was still itchy and getting bigger. Bigger? He showed me his visibly swollen scrotum. No pain or anything, just itchy and swollen. So that's not good, but I don't think it was anything more than a sweat rash that maybe needed some ointment. So we go to the doctor and are sent off for an ultrasound. The scan shows zero blood flow to the area. Immediate transfer to the emergency room. He goes in for emergency surgery, where the urologist surgeon removes one necrotic testicle. It had become randomly twisted, testicular torsion, and died, at least a week prior to, according to its necrotic state. The swelling was a major infection setting in. The itchiness was caused by the infection and skin stretching. He had no pain whatsoever, and the doctor said that was amazing. For most boys, torsion feels like being kicked in the nuts continuously, and by the infected stage he was in, he'd expect crying and screaming levels of pain. Much longer, and he could have developed sepsis. We just thought it was a bit of a rash that got out of hand, and are lucky I took him to the GP, and I didn't just go buy ointment OTC, as I had thought of doing. He had a follow-up surgery a month later to insert a fake testicle and to stitch his remaining live testicle to the scrotum wall so it can't commit seppuku like its brother. Yeah, as a guy with testicles, this was very hard to read, very painful, very cringe. And also, side note, I didn't know that they made fake testicles. That's kind of fascinating. Next story. Patient. One day, my stomach area just started randomly hurting really bad. I thought I just had a regular stomach cramp. After 3 hours of the worst pain ever, I went to urgent care, and it turns out I had appendicitis, and my appendix ruptured in the worst way. I had surgery to get it removed the same night. That was 5 days ago. Edit. Appendicitis can happen to literally anyone at any point. If you feel completely drained of energy or fatigued and have intense stomach pain so bad you can barely breathe, please go see a doctor and don't hold off like I did. Next story. I'm making my internship, and one night I was attending a triage at ER. Triage is the area where you check the patients and decide how urgent is the attention they need. Context here, I'm in a third world country, and I'm at a public hospital that attends uncovered population. And instead of one hospital with all the specialties, we have 3. The main one, the Gyo Hospital, and the Children's Hospital. So I have this woman of late 30s. She started telling me she had an extreme pain, 10 out of 10, in the lower abdomen. No other sign that food could be involved, neither kidney stones or urine infection. I proceed to ask about the last menstrual cycle. She doesn't recall the exact date, but she says that was like 4 months ago. Without hesitation, and without asking more or anything else, I told them, she and her familiar, to go right away to the hospital that was crossing the street. Because if it was something obstetric, we didn't have any Gyo in this hospital. And if it was something of general surgery, they had general surgeons there. We got a call like 20 minutes later, lol. That woman delivered her baby at triage at the other hospital. Next story. Psychiatrist here. One of my first patients was a female college student that couldn't sleep because of voices that constantly talked to her, and she felt forced to answer them at all times. From what she was saying, I gathered that depending on the particular voice, with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16, if I remember correctly, and we've met when she was 20. So at that point, for 4 years of her life, she believed it was normal to have such voices in your head, because, as she explained, many people talk to themselves. To some extent, she was right, but I had to explain to her that they really talk with themselves, that there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them in their own privacy, so to speak. She was later diagnosed with schizophrenia. Next story. Patient thought I was dehydrated after a stomach bug. Called the doc and was frustrated they recommended the ER in case I needed IV fluids. Left work mid-morning and told my boss I'd be back after lunch. ER did a CT scan and turns out it wasn't the stomach flu. I'd had an ovarian cyst rupture and had a grapefruit-sized mass of internal bleeding and clotting, and was anemic to the point they talked transfusion. I was admitted for emergency surgery to stop and remove the blood and stop the bleeding. They also removed my left ovary, which pathology showed had torsion. Next story. I was the patient, and it wasn't as crazy as some of these stories, but I got my eyes examined and found out I have terrible vision. I'm almost legally blind in my left eye. When the doc had me cover my right eye and try to read the letters, I couldn't read a single one. The eye doctor actually laughed at me. I was 21. I just thought everything looked the way it looked. Getting glasses for the first time was mind-blowing. Next story. Nurse here, 67-year-old, thought she was pregnant. Gotta say, she looked pregnant and that it was all in her abdomen. Like some pregnant women who look like they're carrying a basketball when they're at the end. But she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago, before HIPAA, so naturally the lab announced that anyone who wanted to come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. Next story. Patient here. My psychiatrist saved my life. I've always had heavy and irregular periods, so when I had bleeding that didn't go away for a month, I pretty much just kept on keeping on. Eventually, a doctor referred me to an emergency department because of the constant blood loss. I got told, quote, "It's because you have endometriosis." So for 5 months, I had a heavy period, with doctors just dismissing it. Eventually, my roommate called an ambulance when I passed out in the shower. The doctors did a blood test, and I was admitted overnight for a blood transfusion. Fun fact, blood transfusions make some people nauseous, which is not a fun way to find out you're allergic to an antiemetic. A few weeks later, at about the 6-month mark, I drove for an hour for my regular appointment with my psychiatrist. He took one look at me and told me, proceed directly to the emergency room. Do not pass go. So I did, and was promptly admitted to ICU with a bilateral pulmonary embolism. I was hours away from suffocating to death. Turns out, all the birth control that the original doctors had been giving me to shut me up and get rid of me had caused mass clots. The doctor that looked after me and ultimately saved my life wrote a paper on why it's stupid to ignore a nulla gravida, never pregnant woman in her mid-20s with severe dysfunctional uterine bleeding. Next story. This will probably get lost, but it needs to be told. I'm a nurse, and one day another nurse asked for my help putting in a urinary catheter on a patient. I walked into the room to see the biggest ball sack I've ever laid eyes on. I'm talking as big as a basketball. The other nurse couldn't get the catheter in because she simply couldn't find the chicken and urethra hiding under all that ball sack. I open a new catheter kit, start poking around in there for about 15 minutes. Still no urethra to be found. Urology was called in to place the catheter. Anyway, I get talking to the patient about how in the actual F this happened and why he waited this long to come in. It had been swelling for months. He was a computer programmer who barely left his bed. Even worse, his fiancée was standing next to him the whole time. Neither had thought that he might have needed to go to a doctor or the hospital when his ball sack started swelling months before. Needless to say, it was infected as crap. Next story. Patient here. A few summers ago, I was going into my 4th week with a headache, but since I suffer from migraines, I figured it was just part of it and my medicine was beginning to stop working. My friend convinced me to talk to my doctor to at least get checked up. And it turned out I had a dent in my head, towards the middle of my scalp, and a concussion. My sister and I had wrestled a month prior and I got kicked, but I didn't think anything of it because I've had concussions before and they felt different. I had to take time off work and basically nap for a week to heal. Next story. Patient had all the symptoms of a GI bleed, including vomiting up blood that looked like coffee grounds. Went to the ER, was admitted, and had an NG tube put in. Do not recommend, 0 out of 10. And spent the night in the ICU. They scoped me the next day, determined I had 3 minor erosions, and released me with a script for antacids. I felt awful for the next 2 weeks. Tired, weak, headaches, dizzy, black stools here and there, but I dismissed it all because it was just 3 minor erosions, and I'm stubborn and American, so medical costs were definitely also on my mind. 2 weeks later, my doctor sent me in to have my blood drawn. My hemoglobin was at 4.6, and my hematocrit was 15.1, which is critically low. Like, how are you still standing low? About 1/3 of my body usually has low. Long story short, I was re-scoped at this new hospital, and they found a 2-inch tumor in my stomach. A very rare tumor that usually doesn't happen to people under 40. I'm 33. Had a total of 5 tumors and half my stomach removed a few days later. So this feels more like my first GI doctor thinking this is just a normal 33-year-old getting their quarantine drinking on, where he found the erosions was basically right where my 2-inch tumor was. I don't get how he missed it, but he found what he was looking for, and that was that, I guess. All I know is I'm not paying the $7,200 that hospital wants from me. How they missed a 2-inch mass baffles my mind. Still waiting on the bill for the week's stay and surgery in the second hospital. Next story. Patient here. My pregnancy was really painful. I was the only woman in my family besides my mother, and she never got sick at all while pregnant. I thought it was normal that I couldn't stand straight or go farther than 10 feet from the bathroom, or that I spent days in the bathroom floor unable to keep anything down to the point where I would lose track of my days. My fiance really begged me to go to the ER because of all the pain I had. Turned out I had an acute UTI that was ready to spread to my kidneys. They told me if I waited any longer, I would have miscarried. The thought definitely makes me hold my baby tighter. Next story. Paramedic here. Once I saw a lady in her late 50s with a goiter a little larger than a fist. She had been otherwise healthy her entire adult life, and had not once seen a doctor about it because her brother and father had the same thing, so she assumed it was just a genetic thing that she had inherited. Next story. Patient here. I had horrible back pain that would come seemingly out of nowhere, and it was so crippling, the only thing that made it feel better was laying on a cold tile floor. Went to multiple doctors who all just prescribed painkillers, which did absolutely nothing to touch it. After almost a year of this bullcrap, one doctor sent me for an abdominal ultrasound. I was like, sure, why not? Nothing else has shown anything. And turned out I had massive gallstones, which was causing the pain. Next story. I was the patient. I had Roux-en-Y gastric bypass in April 2017. After I went home from the surgery, the expectation was that I would be on a liquid diet for a week, and then slowly start reintroducing soft foods, etc. I even used a check-in app that reviewed how I was feeling, to monitor if something was wrong. 2 weeks in, and I still couldn't keep down an ounce of protein shake. My, now ex-husband, was getting frustrated with me because he thought I was being deliberately difficult. While he was gone to a city 3 hours away by plane, I woke up in the middle of the night, heaving and dry vomiting. My mother drove me to the hospital in the middle of the night, where I spent the next 12 hours having every test imaginable run on me. Turns out, within 24 hours after my surgery, where my intestine was recommended at the Y junction, had actually come apart, leaking anastomosis, if you want to look it up. And everything I'd tried to eat had just been draining into my abdominal cavity. I was septic and had 4 large abscesses. After emergency surgery, I spent 10 days in the ICU recovering before I went home. The surgeon told my mother that if I'd been even 24 hours later getting to the hospital, I wouldn't have made it. Side note, less than 2 months later, my husband left me. Next story. His entire life, my friend's son showed no signs of coordination. He actually received an award at school for clumsiest kid. He never complained of pain. He was just a normal child who dropped stuff and was terrible at sports. It wasn't until he suddenly became lethargic one day and couldn't get out of bed did anyone suspect something. They rushed him to the doctor and found a tumor the size of a grapefruit at the top of his spine. He died about 6 weeks ago at the age of 15. That is absolutely heartbreaking. I can't even imagine. Plot twist that we did not need, really thinking about the family and his friends that he left behind. That's awful. Next story. God, I shouldn't be reading these. I just got surgery on my own Johnson a couple days ago because it was bent too much. couch. It was specifically 65 degrees bent downwards. And that was my, oh, that isn't normal moment. But I shouldn't be reading these because I'm still scared something wrong is going to happen to my genitals. Also, now that I know that what I had wasn't normal, then why do people use bananas as sexual innuendos? I mean, bananas are also way too bent out of shape. Edit. Your Johnson should bend a little bit, that is normal, but they say if it's bending more than 30 degrees in any direction, then it's not good. Plus, if you have erectile dysfunction and pain when getting a boner, then that's not a good sign either. The pain feels almost like growing pains, but it's a bit more stingy than normal growing pains. That was in my experience anyway. Next story. I was the patient. I thought it was normal to have a heart rate range of 90 to 130 BPM. My whole life it's been that way, and none of my doctors had raised any red flags over it. One had me track my heart rate for a week, but nothing came of it. I knew the average was much lower than mine, but I thought that's just how my body worked. I'm 23 years old and had a heart attack last month. I just got home from the ordeal yesterday. Next story. I'm the patient. I had extensive endometriosis that was never caught by my first gyn. I was having a CAT scan for kidney stones, and they noticed shadows on my ovaries, so they advised me to get them examined. My second gyn did some sonos, and they couldn't find one of my ovaries, so I said, like, you mean my ovary took a vacation without me or something? I went for an open exploratory lap, and the endometriosis was so bad they had to call a surgeon in to cut me open, and another OBGYN in for an immediate second opinion. They did find my missing ovary stuck to my uterus with scar tissue, nowhere near where it should have been, lol. Next story. ITT, from Moulin. As a patient, I've always had headaches, almost daily. About 10 years ago, I started seeing weird auras that would take up my whole vision, and then get a terrible headache that made me want to die. Maybe once a year that would happen. About 3 years ago, we got really good insurance. Then I got several auras right in a row, and I start to worry it's a detached retina or something. So I go and see an ophthalmologist, who dilated my eyes and looked around. He suggested I see a neurologist, and maybe they'll do an MRI. Meanwhile, I had a stomachache that lasted a few days. Very odd for me, since I don't really get them, but it woke me up in the middle of the night one day, and I had another aura visual, but no headache. Saw the neurologist a week later, and boy did he like talking about how fat I was. I had 3 kids in 3 years. I'm squishy, not morbidly obese, with little motion. Deal with it. They were able to get me in for the MRI that day, and despite being claustrophobic, it wasn't terrible. I walked out to the parking lot, and they called me and asked me to come back in. When I got in, she told me I'd had a stroke, and they needed to admit me to the ER. The office was at the hospital already, so she literally just walked me through like 2 doors, and I didn't even have to wait in the lobby. Spent 3 days being poked and prodded. I never really saw the big deal. It was just a stomachache and dancing lights. I'm doing a lot better now. Next story. Not a doctor, but I went to visit a friend of mine whom I hadn't seen in over a year. 6'4" buff dude who ran 10 miles a day and dropped 135 pounds, and I dragged him into the hospital after he said he was having trouble with keeping food in his system for very long, and thought it was normal because he'd always had some digestive issues. Ulcerative colitis, lost a massive chunk of his gut, was on IV nutrition for months, and had to be very carefully monitored because he also ended up with a nasty case of refeeding syndrome. Next story. I was the patient. For years, I thought it was normal to get a UTI every once in a while. Every few years, I'd see blood in my urine, go to a doctor, different doctors every time thanks to moving around a lot, have the doctor say, "That's really weird, guys don't get UTIs very often," then shrug and give antibiotics. After a few days, it would always go away. Then, last November, I had the same thing happen, but with way more blood. Went to the urgent care, who immediately told me to go to the ER, was admitted as soon as I got there, and 2 weeks later I was released, carrying with me a diagnosis for a kidney disease. Turns out that blood appeared every time the filters in my kidneys suffered severe damage. Next story. Not a doctor, I was a patient. I, 14, started getting an upset stomach one night, and it wasn't just another bellyache. Maybe a little bit more intense, but I slept through it pretty well. The next morning, my parents got me an appointment to the doctors to see if I was okay. We get through it all, but we had to wait at one point. Don't remember when, like before we went to the checkup, after, etc. And I told my mom, we should just go home. It's probably nothing. Next thing I know, I need surgery. When talking to the doctor before the surgery, he explained that my appendix had burst and told me I had a very high tolerance to pain, and that he was surprised I slept through it. Afterwards, he also explained to me that if I didn't have surgery when I did, I would have died around 1 to 3 days later. I can now see why a lot of people think that not feeling pain wouldn't be good. Next story. Completely opposite thing. I know my chronic pain is not normal, but all doctors give me antibiotics, which by now I must be immune to, and send me away. It only helps for a few weeks or months, then the infection is back. Edit. For everyone asking, it's kind of embarrassing, but it's painful when using the bathroom, like a UTI. I've been to multiple doctors, urologists, etc., and they take tests, give me antibiotics, and then call me like a week later to say that nothing showed up in the tests, but that I should take the antibiotics anyway. I ask what else I can do, and they're always like, well, pee after sex and clean down there regularly, and etc. But I do all those things and more. If there's something that people say to try, I've done it. I think it's more from stress, but it's been on and off for about 3 to 4 years. Next story. Not the doc, but the patient. Someone gifted me a free set of adjustments with a chiropractor. I had always been skeptical, but decided to try it out since it was paid for. And after the first adjustment, I told the doctor I didn't even realize my back was hurting. I just thought that's what it felt like after a certain age. Turns out, constant throbbing back pain is not normal. Glad to be proven wrong, because it means I can do something about it. It was the first time I haven't had consistent back pain since I was 14. Sports messed up my body from a young age. I thought it was just part of puberty. He erased more than a decade's worth of pain in under 10 minutes. Next story. Not a doctor, but when I was in high school, I would have terrible period cramps. They were so bad I would throw up and would be shaking. I couldn't pay attention in class and literally failed exams because the pain was so bad. My mother told me that was normal and that I needed to stop making such a big deal out of it. A friend told me that going on the pill would make my periods easier, but that was not allowed. I was told to drink more water, do more exercise, or use a hot pad. As soon as I turned 18, I went to Planned Parenthood and asked to be put on the pill because I was sexually active. I assumed that if I told them it was because my periods were painful, I was throwing up, they would just think I couldn't handle being a woman and would not give it to me. The pill helped, thank goodness. It's been 12 years and I've never had a non-hormonally induced period since then, and I'm now on my second hormonal IUD, which prevents my periods entirely. I only just learned from my gynecologist that what I was experiencing was not normal and may need to be looked into further. If you have painful periods, it isn't your fault, and don't let anyone make you think it is. It's also not normal. No young woman should have to go through that. If your parent doesn't believe you, find another adult to trust who may be able to help you. Next story. I worked with the Amish for a while, so I've got some great, I finally got around to addressing this after taking care of my harvest stories. But my favorite is actually a non-Amish chick. She was asking why she gets rib pain so often, and literally reached under her own rib and jiggled it with her fingers. Turns out there were a lot of other things she could do that she shouldn't ever be able to, and she had a variant of Ehlers-Danlos. Literally, I was so distracted by the popping in and out of her rib that I didn't even notice how horrifying it was that she could get her hand under there to begin with until I retold the story to a coworker. Next story. Patient here. I had been suffering from debilitating pains basically since I was 14 years old. There would be worse around my periods and kind of dull down a little after. I was told this is normal. At 18, I started searching for answers because the pain was getting worse. I went to 7 different doctors in 6 years. I was either dismissed as it being normal period pains or being misdiagnosed. One doctor tried to tell me it was irritable bladder syndrome. I'm no medical student, but even I know that's not a real diagnosis. I was on all kinds of different birth control and pain medication, which didn't help. At 23, I was finally able to see an OBGYN who specializes in pelvic pain. She barely even touched me before she was saying, "Oh my, you have endometriosis," and scheduled me for the first laparoscopic surgery in January. During that surgery, not only did they find that I have the highest and rarest severity of endometriosis with complications, but they removed several golf ball-sized cysts that were ready to rupture. She told me I must have had really high pain tolerance because I should not have been able to walk upright into her office that day with everything they had found and removed. The most amusing part of this, before seeing the specialist, I had 3 ultrasounds and several other exams, but no one detected or even bothered to look for endometriosis or PCOS. It was that simple pelvic exam that saved my life. Next story. Not a doctor, but a former carer. My father felt a loud pop as I was helping him out of bed. This wasn't unusual, and my father thought he just pulled something. However, the pain didn't subside for weeks. I dragged him to the GP, and then to the hospital for a scan. The pop turned out to be the back of his rib totally separating as the bone was mostly powder. Lung cancer from smoking as a young adult had grown through the back of his lung and into his ribs and spine. He was in palliative care from then on. At least he got to say goodbye to his cat, Tilly. I brought her into the hospital and let her loaf on his chest with her bum in his face for one last time. Next story. My mom is a medical assistant in a pediatrics office. Like 2 years ago, a lady came in with a gash in her heel. She had the gash open for weeks. My mom undid the wrapping the lady put on her foot, and there were bugs eating at the lady's flesh inside her foot. The lady thought that the tingling was a bad sign and that she should get a checkup. She said she thought the tingling was normal and just wanted to check. My mom and another MA had to dig out 6 bugs from this lady's foot. The night she told me this, I was dumbfounded by how stupid this woman was not to go see a doctor once she got the gash. Next story. Not a doctor, but the patient. When I was about 7 to 8, I noticed one of my front teeth was growing in a bit weird, but I just shrugged it off until my next dentist appointment. Immediately after opening my mouth, I heard somebody go, "What the hell?" Turns out that tooth was growing in sideways and a weird mass of gum grew on top of it. After 2 minor surgeries, they extracted part of my gum and my tooth, leaving a huge gap in my mouth. Luckily for me, there is another tooth above that, so my teeth are now perfectly normal. Next story. One night, when I was 16, I had a very sharp pain in my right side. I tossed and turned for a couple hours before getting up and knocking on my mom's bedroom door, a forbidden action. My mother swung the door open and snapped at me, what did I want, and when I explained my pain, she told me it was heartburn, to drink some milk and go back to bed. I drank the milk, tossed around my bed for a few more hours, and finally passed out from exhaustion. Next day, I felt fine. A couple months later, the pain was back, and I again woke my mother. Same response. I eventually passed out from exhaustion again. The next time I felt the pain, I didn't bother going to my mother and just wrote it out. This continued until I was 18. My parents were out of town one weekend, and the pain came back worse than ever before, waking me from a dead sleep. After hours and hours of utter agony, hurting to move, hurting to lay still, I broke down and called my mother, leaving her a voicemail that I thought I was dying. I finally passed out as the sun began to rise. I was woken by my uncle banging on the front door, and he took me to the doctor, who referred me to an ultrasound office, who had referred me to a surgeon. While I saw the first 2 the same day, the surgeon didn't have an availability until the end of the week. Didn't think anything of it, as once again, the pain was now gone. Mom begrudgingly takes me to the surgeon appointment, but I'm pretty sure she thought I was faking it since I'd been completely fine all week. I remember sitting in the office with the surgeon, just chatting while we waited for the nurse to bring him my ultrasound file. I'll never forget when she handed it to him. He opened the folder, and the smile immediately fell from his face. Surgeon goes, "Did they give you any pain meds when you went to the doctor?" And I say, "No, just some antibiotics." "Why?" Surgeon says to the nurse, "Nancy, call my 2 o'clock and tell them we have to reschedule, as I'll be in emergency surgery." And then to me, "You should have been sent to me last week. I'll meet you in the ER." So yeah, my gallbladder had apparently been filled with stones since I was 16 and making more still for the last 2 years. The surgeon said he'd never seen anything like it, and my mother told me she overheard some ER nurses question how I was still walking. I guess mother didn't think that her mother having a gallbladder out at 16 and herself having it out at 18 was worth considering when I first woke her with pains in my side. I thought I just had heartburn. Next story. There are so many, but perhaps one of the most stunning was the man who thought searing pain while urinating every once in a while was normal. He would have tremendous back pain for a day or so, which he thought was due to advancing age and the highly physical nature of his job. Not incredibly unreasonable, but something he should have still checked out. Usually, a few days later, he would have searing pain while urinating, then be fine again. Of course, it turned out to be chronic kidney stone formation. He said he never noticed the stones coming out because he never looked down while urinating. Honestly, I still don't understand. I've had kidney stones myself, and it definitely feels like something solid coming out. Baffling. Next story. PA at my pediatrician thought a spider bite in my arm was swollen an appropriate amount and told me not to touch it. Went home overnight and it was twice the size the next day. Went back and asked to see my normal doctor and he immediately sent me to the ER. They drained a quarter cup of pus out of a bullet-sized hole in my arm and I had to be treated for MRSA and now I have a cool scar from a brown recluse spider bite. Somehow didn't lose my arm, but almost did because the PA thought I was overreacting and my arm swelling to twice its size was normal. Next story. Not a doc. When I was diagnosed with type 1 diabetes, I had just completed an NCO of the year complication. After all my training, I was nearly passing out and cramping through the whole thing. For 2 days after, I could not get dehydrated and was pissing constantly. I thought I'd just gone that hard. After all night drinking water by the gallon and pissing like I was a fire hydrant, I decided to go to the ER. My blood sugar was 890. Normal is between 70 to 80. They asked how I wasn't extremely sick and suffering ketoacidosis. I simply replied, quote, "I have to be the soldier of the year." The nurse came in to diagnose me and said, "You can live a normal life, besides being military or a pilot." She laughed. I was an infantryman trying to go to WOC to become a pilot. I've never before had the urge to choke someone until then. Jokes aside, I lucked out. I'm glad I'm not in the service, whilst this turd bucket is in office. All things considered, I consider myself lucky. Next story. Not a doctor, but I know my friend had always suffered from abdominal pain ever since he was a small child and was just used to it. One day when he was at the doctor, chest pain came into the conversation because of something completely unrelated, and he found out he had a biffed rib, essentially where a rib splits into two. Afterwards, when he was talking to us, he was like, "Guys, is it not normal to just have chest pain?" Luckily, it's nothing lethal. Next story. Not a doctor. My buddy was doing a cable service call for a new customer. They were just chatting when the customer explained he had brain surgery recently and pulled off his hat to show the scars. Buddy said he gagged and called 911 immediately. His head was full of bugs and it looked like meat left out too long. The customer was elderly and no relatives lived close by to help care for him. He thought the aches were from surgery and ignored it. Next story. These stories are actually a dime a dozen. It's kind of baffling. Admitted a guy last week who came to the ED with chief complaint of some right-sided numbness for the last few days. Presumably had a stroke. Turns out he also had a rapidly progressing gangrenous infection of his scrotum, thighs, pararectal areas, which required emergency surgery. He wouldn't have even sought out medical attention if it wasn't for his stroke. Also had a patient not even mention that he had been paralyzed from the waist down for the last week, which was new for him. Never even mentioned it. Did complain about his nausea though. Next story. Patient here. Stepped on a nail at 6 a.m. Pulled my foot off the nail and went to school. Walked around all day in flip-flops. Sister made me go to the ER in the afternoon. Foot was all swelled up, and Doc said that if I had just gone home like I wanted, I would have died in my sleep from the infection. Spent 10 days in the hospital getting IV antibiotics every 4 hours. 5 days of that, and there were serious conversations about amputation.